Welcome, everyone. We're going to be discussing oppositional defiant disorder from a field research perspective. So I was incredibly fortunate to reach out and get in touch with Dr. Laurencia dos Santos here in the local Fredericksburg Clinic for L-Rope Psychology Solutions. And we basically discussed oppositional defiant disorder from a real-world perspective. So really it came down to understanding what ODD is, what the standards of care, assessments, treatments, her take on family involvement, and something that she's been seeing in the field that is causing some concern, which is primarily about misdiagnosis. So first, we kind of want to understand what ODD actually is. And this is a condition we see when there's a pattern of behavior of irritability or argumentative or defiant behavior to authority figures from children. And most times these behaviors are distracting, not only for themselves, but for the peers as well in their classroom. The condition is really commonly seen in late adolescence. I believe Dr. DeSantos has said that she usually sees from ages 8 to 17, but the DSM says you can diagnose as early as age 5. Most children usually have defiant behavior at home, and this is kind of where the key of the diagnosis sits in. They also have to meet a minimum criteria of 4 conditions, and the duration has to proceed for longer than 6 months, but 6 months would be the minimum. And it has to impact their social and emotional well-being in school and sometimes out in their social networks. The biggest and most important piece to it is the client-counselor relationship. If these children cannot trust the adult that they're talking to, usually they will not be able to work well with the counselor. And we also have to remember, we have to think about understanding the parental rights and the fact that children cannot consent to counseling without their parent permission. So again, we have to explain confidentiality to these students or to the clients, because they really need to understand where the limitations are. And this is unfortunate because ODD is one of the most common conditions that refers for treatment. So assessment for this group is key. And I was recommended to use the behavioral assessment system for children because it's one of the most extensive and it's usually the most comprehensive exam that we can give. And when we're working with students like this, when we're thinking about the methodologies of how to treat these students, usually it has to be child-centered. So individual psychology works great in these cases, but then we also have to consider skills. So ABA works excellent because it does teach those interpersonal skills and communication and empathy. And then we're also looking at the cognitive behavioral therapy to come in later when we're dealing with the family units, because they're going to become super important. So the factors we also have to consider in treatment, we have to examine the child's life, and we have to look at possible trauma. We're looking at home life. We even have to consider misdiagnosis, because that does occur, and it's something that they're seeing a lot of recently. We also have to look at support networks, who's available to the child and who's actually involved with most of the parenting. And then at the end, we'll have to look at how to help those parents in dealing with their children, because we know that there can be frustration in families. So that's why the scripture I chose was fathers and mothers. Do not provoke your children, lest they become discouraged. So here's the importance of solid foundations, and especially I always think back to Matthew 7, because it talks of the smart and wise builders who follow God's plan and build their foundation on rock. The same thing has to occur with families. And when we build our foundation stronger, we can implement healing. So solid foundations for families are going to include effective communication with grace and patience. They also are going to have to learn some perspective taking for both the child's perspective, and the parent's going to have to explain their feelings as well. And in this process, we also have to put some goals of committing, loving, and respecting each other, and implementing some quality time spent with one another. This really does help to build the relationship between the parent and the child. Another great technique is parent management training. It's been shown to teach authoritative techniques so they can set their limits, implement rules, and oftentimes they can have better explain the expectations to their children. And this goes again into communicating, but communicating with reason. So, and we also want to avoid harsh discipline. It never works effectively. And using the tools they have, they can reach the ability to no longer be reactive with their children. Now we're going to go into a bigger issue with the problem of misdiagnosis. And many times we're getting primary care physicians who are referring and not understanding anything about human development. Children's responses to anxiety are always going to be different, but a lot of them will be oppositional, and it's a normal reaction, but doctors sometimes are not seeing it that way, and they just automatically go to ODD. So when they do that, they distract from other diagnoses such as spectrum disorder or maybe another condition that is more serious, and it keeps from social and psychiatric treatments from being implemented that'll be more helpful. And then we also have to consider the parent factor. Some parents do not want their child labeled with the certain conditions. So we have to make sure we're explaining to parents what these conditions actually are. And at the end, we always have to hold others accountable. So we always want to do our best care practice. And we do have to do that with our peers and working professionals. So again, I want to thank everybody for listening to the presentation. And again, a special thanks to Dr. DeSantos for actually giving me such a great interview. And if any questions, please feel free to reach out. Thank you so much. And here are my references.